I thought we'd get Dr. Dean on to see whether he could shed any light on it, really. Dr. Dean, very good morning to you.
Good morning, Mike. It's nice to see you again.
Good to see you, yeah. I mean, I'm not suggesting that this is something that's being done everywhere, but I think there's certainly evidence that it's being done quite a lot, where a lot of people have been in touch with me, and I'd say by the dozens, who have had they've been waiting, say, for a year for an appointment of some kind or other, or an operation. They suddenly get a letter saying the operation has now been scheduled, and about 2 days before the operation is about to be done, it gets cancelled. And I'm wondering if that then approves somebody who can then move them onto another list, so it looks as if they haven't been waiting as long.
Well, I think where there's smoke, there's fire, and enough patients are talking about it to make us concerned. I wouldn't say it's necessarily an NHS scale strategy to do it. I think most hospitals have their local policies about how they deal with their waiting lists, and when there are certain pressures, they come up with ideas on how to deal with those pressures. And some of those ideas have unintended consequences. I can give you examples in my local region. We have problems with audiology, so hearing tests, where patients are waiting far longer than 1 year. And at one point, we actually had the entire process of being able to refer for hearing test just cancelled in the region. We just couldn't refer patients. So there's a lot of work locally occurring to get on top of that waiting list. But what we're hearing from patients is that some of them are being sent letters that never turn up. Some of them are having phone calls that never seem to be documented or happen anywhere, and they're being told that they didn't respond and therefore they're cancelled from the list. So they come back to us saying, I've suddenly been cancelled, can you please refer me? But what we're being told from the hospital is that the waiting list is going down. Well, it's unsurprising to see that the lists are going down when the patients are being told that they're not being dealt with and having to reapply. So there's something going on here.
I think there is, because other people have said to me that they've also had letters from their NHS trust saying, do you still require this procedure? And so presumably some of those letters either don't get answered or some of those letters go astray. And if they don't get an answer, if they don't come back with anything, they get knocked off the list as well. So, I mean, I've got this from Lynn in Yorkshire. She sent this message in to us this week. My husband was referred for a hip replacement. He had an appointment with a consultant on the 2nd of April. He had a letter last week cancelling it. He hasn't been given another date, but it means he was given an appointment within the 18 weeks, even though it was cancelled. So, you know, it does sort of look like something's being done deliberately here, seems to me.
Yes, and I think it's a genuine effort to try and help the waiting list, because in theory, in a meeting, it sounds useful, doesn't it? Well, let's text the patients and ask them if they still want the appointment. And then when those texts go out saying, do you still want to be seen? But you don't necessarily have a mobile phone, or the number's been put in wrong, and therefore you don't respond, and then you're kicked off the list. It helps the waiting list look great, but it's not really good for patients. So I think it's well intended, but has unintentional consequences that's probably harming patients who are waiting on a list.
No, but it also enables the government to say the waiting lists are going down when they might be going down for reasons other than patients actually being seen.
It does, of course, and that's why these meetings take place. So hospitals get a huge amount of pressure put on them from the NHS above saying, please sort out your waiting list. So there's a mad scramble to think of ideas of how to solve the problems. And these are the sorts of ideas that come through. So rather than just a good old-fashioned waiting list or phoning the patient, and if they don't respond, try again, and if they don't respond, send them a letter, it's 2 strikes and you're out. But you may never have actually had the opportunity to respond, but you're out and you're back at the end of the list again. It's not appropriate for patients. It keeps them waiting, it keeps them sick, but it does make the numbers look good. Yeah,
exactly right. And what's going on with the GP contracts? Because I'm under the impression, I think, that there was a deal done, was there not, sort of beginning of the year, which we're now into the 3rd month of. Has there been a deal done? Are GPs now happier?
Yeah, there's a big sigh from me there. No, GPs are not happier. A deal has been struck between the British Medical Association and the government, but quite frankly, it's £800 million of investment that, in my opinion, is absolutely wasted. They should have kept the £800 million because it's not going to do anything to help general practice deliver care for patients and to help patients. I'd rather they reinvest that cash elsewhere. The BMA, however, are celebrating this and saying that they've now managed to solve the problem and therefore they're dropping collective action. I think dropping collective action is great. I never was a big fan of it, but actually what they're saying behind closed doors is, although the BMA is not supporting it, they're still asking GPs to do it and promoting it amongst GPs. So the problem hasn't gone away. It appears to be a huge waste of investment, and we have massive problems in general practice that just aren't being resolved.
Right. And so what should they be resolving then?
Well, the main problem is obviously nobody can get to see a GP. We don't have enough GPs. We don't have the money in the right pots that it needs to be in to pay for GPs, and we don't have room to put GPs in. Now, I'm not saying we don't have enough money. There's lots of money sloshing around in the NHS system, but it's not in the pockets of GPs where it can be spent on GPs. So some of this is just about simple red tape. At the moment, we have a huge number of GPs who are unemployed, who should be employed. And even if we employed all of those, we still don't have enough GPs. So, quite frankly, simple solution: we need the money putting in a position where we can spend it. We need to be allowed to buy GPs and to buy rooms, and that will start to solve some of the problems. It would only take a week, really, being sat around a table and resolving that, but there doesn't seem to be much intention by either the government or the BMA to do that.
No, indeed. Good to talk to you, Dr. Dean. And how many days you worked this week, Dr. Dean?
I've worked 5 days this week.
Did you? Well done. Fantastic. Must be coming up to the Easter holidays. Dr. Dean Eggitt there, GP in Doncaster, CEO of Doncaster Local Medical Committee, our friendly neighbourhood doctor. He's